guys, welcome to my channel Pran the Life. My name is Pranav Patel and I'm going to talk to you about types of mask and how we use it. In this 2020, after pandemic, in future or any time, it is very important to know what kind of masks are available in the market and what you can get it. So let's go. So there are masks and there are respirator. Masks are used for the general population and there are three levels. Level 1 surgical mask, level 2 surgical mask and level 3 surgical mask. While respirators, they are N95 respirators. So we'll talk about them each one individually and in detail. So there are surgical masks, which is level 1, level 2 and level 3. So this is level 1 mask. It has smoother surface in the front, softer surface in the back, and then you use it like this. Remember, you cannot just put this mask like this. You have to make sure that there is a metal rod which you bend in based on your nasal bridge so that it locks in, and then you open it up so that it's a snug fit. This is for general use. If you are going to the hospital, if you are going to the grocery store, if you are going anywhere in general, or if you are just seeing your relative or someone to the hospital, in that particular time, if you go, you use this mask. That is level 1, that's basic. It has one small thin layer inside and it is better than the cloth mask. Cloth mask is regular mask. You can use it or make it from any cloth or anyone available in the market. You can use them. They are better than you are going to the bare mouth. And this is level 1. This is slightly better than the over the counter available the cloth mask. So level 1 mask. The next one is level 2 mask. So this is level 2 mask. And level 2 mask is having little bit thicker side. It has 2 layers. First layer is in the front, which is thicker but smooth again, and the softer layer inside, which is like having another thick part, and it is better than the level 1 mask. And this used for the moderate exposure, or you can say that if you are staying with the patient a little longer and you are suspecting that they will cough, they will sneeze, and then you are going to come and expose to them, but they are not having any diseases which you are concerned of. So for example, not the patient with COVID-19 and you go and see them, because this is just for your simple protection in general. So this is level 2 surgical mask. If you are doing any procedures, yes, any dental procedures, you can use that. And level 1 is also good. Now level 3 mask. Level 3 mask is even thicker than level 2 mask, and it has again same softer side and deeper side, and same concept. You go in, you use this thing like as a nasal bridge, you clean it up and you make it widen with the gap in there. So once you use this is for longer exposure, even longer, or if you are in the surgery, if you are thinking that you are exposed for little longer time, like if you are doing any ultrasound guided procedure, so for that. And this is for medical professionals. This is not for routine population that you should use the level 3 mask. Yes, if you are having patients, those who are having influenza viral infection or some flu virus that you are suspecting that you may catch it, and in that case, if you want to use that, yes, this mask is beneficial. Level 2, level 3 you can use, but this is not, as of now, with the scarcity in the pandemic, you better not to. If a patient with flu or any viral illness, those who are on droplet isolation, like those who are at the risk of sneezing and coughing, and then you are trying to come in contact with them, then we use this level 3 mask with the shield. So this is a shield, like the paper shield, and then you just put it on there. Once you put on there, then you snug fit, and once you snug fit that, then you are covered. So this is used for the physicians or the doctors or anyone, those who are doing procedures. Like if you are trying to place the central line, if you are trying to do any interventional procedure, any surgery, any operation that you feel that the blood or any serum or anything will split up and it will come on your eyes, then you should use that face mask with the shield. Normally in patient with influenza every year in the winter season, then if patient comes with the flu, if you haven't used that, then you have to use this kind of face mask with the shield, and that benefits it. Now, since COVID-19 came in, the routine level 1, level 2, level 3 masks, they feel that they are not sufficient. And China has their own way to deal things, and then they came up with their standard of KN95. Remember, KN95 is not N95 mask. N95 is not a mask, by the way, it's a respirator, N95 respirator, and they are very robust, and then they are the most effective for any COVID-19 or any patients, those who are like having active TB, those who are requiring airborne isolation. So for example, like the molecules are like all floated in the air in the room where the patient is or where the person is, that's when you use N95. This is KN95 and it goes with GB2626 2006 or GB2626 2019. So KN95, it is having smoother surface outside and it softer surface inside. Then you open it up, it makes like a beak, like you will feel like a bird, like here, and then you again put this, like there is a thin metal rod here that you bend in, and then once you bend in, then if you breathe, if you see that it just opens up, it has a good better seal compared to the regular surgical mask. So if you breathe in, breathe out, you can see that it just flows out and in, out and in, out and in. So this is what like a good fit. You have to have that good fit, otherwise this KN95 is not sufficient. By the way, still KN95 is not the optimal way. As per the personal use and as per the medical professional, we feel that they are not as effective as N95 mask. N95 respirator. Remember, N95 is a respirator. They are having thick layer and they are made to go for any significant airborne pathogens like COVID-19, like tuberculosis, and it has two types. So this is one which is like a round shape, and this is like commonly used. Usually 3M is the one that makes it, and this is the second one, which is, we call it like in general, this is like a duck face. So it just opens like that, and it has usually having two layers, and that goes all the way in your bag to put in. So first we will work on this one. So this N95 mask has this is the front, which has like a big rod, and it is very very thick. It has the softer surface outside and smoother surface inside, but it is very thick and very nicely made. It has already a name like the logo, badge, what company makes it, because it is very regulated mask, and this is used by medical professionals when they are exposing to a very risky, say for example, if you have COVID-19, if you have patients with active tuberculosis or any airborne pathogens like anthrax or something that came in the past, then you use N95. And N95 is like only for those or relatives or family or it's a medical worker person, those who are coming closer to patients, those who are having COVID-19. For them, this is the one to go. So they put this, there are like two parts. The upper part goes up, the lower part goes back. You make sure that this is a snug fit and this rod is very tight. Once you put it, and then you make sure that the seal all over all your face is good. Again, my beard is not good, so you have to make sure that once you do that, then you breathe. I can breathe as much as I can, but still you will not see any fog on my glasses because there is no leak, nothing. It's just so tight and snug fit. But if you do this long, you will get some like a skin imprint on it. So this is One, sometimes some people, while using this long time, they don't prefer this shape. So they prefer, which is like make you less claustrophobic, and this is the duck one. Then like this, but you have to use it properly. If you don't make it like a proper fit for N95, then it is not worth it. So in general, in hospitals, for medical professionals, not for in general population, but for medical professional, we usually do fit testing of this N95 mask. So they made sure that we spray some odorous material, and then when we have this mask on, it is just sprayed around, and if that penetrates the mask and if we get that odor, then we are not properly fitted. So we have to make sure that it's a fit tested. And this is the duck face. So in duck face, again, it's the same thing. You open it up, you put that one, and then there is one part which is like goes up, the other part goes down, and then you have to bend based on your nasal bridge, and based on this, it is just a snug fit. Now you can see that it goes up and down the moment I breathe. Because it is so tightly fit, only air has to take time to go in and out, but it is so covered and sealed all over, so it's good. So this is N95, two types of them. Now in the rising COVID-19 time, if you see any patients, or if you are trying to go closer, like in a 6 feet vicinity, to someone who you know that they are having diseases that can be sprayed to you, or you are prone to that they will say splash something while sneezing, while coughing, or something that can risk you exposure over your face, then you use the one with the shield, or not like this, but N95 respirator. Once you do that, then I think you are having a good face cover. So this is how we professionals try to go and see the patients, those who are very, very sick. For general population, I would suggest two things which are very important when you choose the mask. Make sure you put it well, and remember that there is like a road or small soft road which is in level 1, or any mask if you go and if you buy from, so that goes up from the nose side. You bend it, and then you put it like this in the back of that, and then make sure you open this up, which is like this creases are for that, so that it covers your face. I have seen many people, those who are just like doing, not even bending it, they just do this. That's it, that they got the mask and that's it. But it is so open, like I can talk, I can do whatever, but the air is like coming from here, passing from here. So you make sure that you fit in nicely like that. And this is the way you wear mask. So again, for revision, there are level 1, level 2, level 3 surgical mask. For general population, level 1 surgical mask is good when you are going outside and doing no activity, but just like trying to be safe in the community, or like in general, you go in any shop or any activities. If you are trying to have nothing, and if you want to cover yourself, use any mask or any bandana or any color, any cloth mask. That is important. As of now, with the rising COVID in 2020, your safety, you make sure you cover your face, and that is very important. This video, I made it is for education, and make sure that you use it wisely, because using that and not spreading COVID-19 can save someone's life, your loved ones or somebody else's loved ones. And if you want to continue to listen informative and medical related knowledge, then subscribe to my channel Pran the Life. And this is Dr. Patel. I'll catch you next.